Tonight, doctors at Eisenhower Health say they are seeing a plateau in coronavirus cases, but they're still concerned there could be an increase in cases here in the Valley for a number of reasons. I spoke with the Chief Medical Officer, Dr. Alan Williamson. Dr. Williamson, it's so good to see you again. Thanks for joining us.
Thank you for having me back, Peter.
First off, what's the latest at Eisenhower?
So we continue to see really a kind of a nice plateau in the number of cases that we're seeing at Eisenhower. Not a huge spike. It does fluctuate a little bit from day to day, but typically somewhere between 10 and 15 patients in the hospital each day. And that's been holding really pretty steady for the past month or so.
What do you make of the county going back into the purple tier?
Yeah, unfortunately, the county as a whole is not performing quite as well as what we're seeing in the Coachella Valley. Our numbers valley-wide are definitely a little bit lower than they are throughout the county. And, until they see that positivity rate in the rest of the county come down, I understand that they feel they need to continue to try to control this any way we possibly can. And if that means having to shut down some of the inside dining and some of the businesses, that's an unfortunate consequence of that. What we're seeing here, I think, is the public really being aware of the fact they need to continue all of their efforts to control this through the social distancing, hand washing, and wearing face masks. And as long as we continue to do that, I think we can continue to keep this in check and hopefully allow us to get back to that red tier, get the restaurants opened again, and so on.
Are you anticipating more cases because of Halloween and possibly more cases because of the upcoming Thanksgiving holiday?
Right. I think we worry about every one of the holidays that come along. We haven't seen anything yet from Halloween, but it would be early for that. Thanksgiving, I think, is a significant worry because traditionally we obviously get families together at Thanksgiving. And if we do that, I do fear that we're going to see an increased number of cases. And then the unfortunate thing is that also coincides with really the return of a lot of our snowbirds, and we start to see the population really go up late November into December is typically when many of these people are arriving. And if we look at the maps of the rest of the country, we know most of the rest of the country where many of these people are coming from are seeing upsurges in their cases really across the whole country. So are they going to be potentially bringing cases with them, infections with them? And just having the additional population here means we have more people at risk. So I think we do have a lot of concerns about what's going to happen over the next couple of months.
I'm curious, of the patients you're treating, are you seeing people becoming more sick compared to the original group of patients that came into the hospital, or is the disease becoming more deadly or less deadly?
Yeah, overall, I'd say we're seeing less deadly and less severe illness, partially because we're seeing more younger people infected, and they tend to be less severely affected, but they are not immune. They should not be cavalier about thinking that if they're in their 20s or their 30s and they're healthy, that they can just not have to worry about this illness, because we certainly see some of those patients becoming very, very sick. But overall, they tend to do better than our 70 and 80-year-old patients. So I'd say, statistically speaking, we're seeing less severe disease. I think we've also gotten a bit better at understanding how this disease works, how it attacks the body, and what we need to do to intervene to help. And so we're seeing less patients requiring intensive care unit stays and so on because of earlier and more directed therapies for treating them.
I know you're not an expert in terms of predicting when this is all going to end. Obviously, nobody is, but it seems to be, we're hearing that this is going to be going on through much of 2021, perhaps. What are your thoughts on how long this pandemic is going to last?
Yeah, I think the only way that we're really going to see the pandemic truly go away is either just a long time and eventually it's going to burn itself out one way or the other, or much more hopefully that we will see an effective vaccine that can break this cycle. Even with the vaccine, there's still going to be a lot of question marks about how long-standing that immunity is, and are we going to have recurrent vaccination in order to prevent this from coming back and so on. But even if we have a vaccine effective for a period of months, if we can really get that out into the community, people use it, then we can sort of break this cycle of infections and reinfections spreading through the community. So that's what we're all hopeful for, that, hopefully by perhaps spring of 2021, even possibly later in the winter of 2021, we may see an effective vaccine out there that's really widely available. There's a lot of talk on and seeing those vaccines sooner, but there's a big difference between a vaccine being completed and being shown to be effective and actually getting it mass produced and distributed out into the community to all the people that need it.
So there's a real possibility, Dr. Williamson, this could last all through 2021, all the way into winter.
It is unfortunately quite a possibility that could be the case.
Okay. Well, as always, we appreciate your time. Dr. Williamson, thank you so much for joining us.
Thank you, Peter.